and then we're going to go through these different things up here on the whiteboard. And what we'll do is kind of talk about the different ranges of motion, and then we'll talk about positions that a lot of people find themselves stuck in, and then we'll go through some exercises to help out with hip range of motion. So the first thing we have here is rotation. So this here is going to be internal rotation, where the leg kind of turns inwards from the femur, that's the hip, to the knee. That bone is going to twist in, and then the foot is going to actually go out away from the body, but the leg is twisting inwards. And then we have hip external rotation. That's where the femur rotates away from the body, and the foot comes across the midline and rotates the femur externally, so twisting out. And then we have down here hip flexion. This is where the leg raises up forward. This one has a little knee flexion here, but it doesn't necessarily have to be in knee flexion. The leg can be straight like we have here in extension. And these are going to be opposites of each other here, and we're going to go through those ranges of motion as we work through like just walking. So it's important that we can flex the hips as well as extend the hips to just accommodate walking, especially if we start climbing stairs or climbing up a hill. The more we're going to need to be able to go into flexion and extension together. And then over here we have hip abduction. That's where the leg is going out, and this guy is standing in abduction at the moment. And then to bring that back in, it's going to be a deduction or adduction, and that's bringing the leg back in towards the midline of the body. So a couple things when we are going through some of the posture stuff. We're talking about people who kind of have their pelvis tucked underneath them. They oftentimes are easier to go into extension, but they have a harder time going into flexion. So for those folks who want to work on developing a little bit more hip flexion, and then for the people that arch their back more, a lot of times it's easier for them to go into hip flexion, but they have a harder time going into true hip extension. So a lot of times what these folks will do is they'll compensate hip extension for lumbar flexion. So they'll actually flex their low back to take their leg out behind them, as opposed to keeping this nice and braced and then squeezing their butt and hamstring to take their their leg out behind them. So what we'll work on with those folks is trying to kind of just work on true hip extension as opposed to flexing the lumbar. And then with people who have that slouch position, a lot of times they're going to be slightly externally rotated, because the glute is going to cause them, like that tight glute is going to cause them to be externally rotated as well. So we're going to go ahead and just dive in to working on hip mobility drills, and then we'll work on some stabilizing techniques. And what we'll do is kind of just cover all of them in general, because if you're tight in the hip flexors, like you might be tight in this range, but like you're not able to access this range. So like all these exercises are going to be applicable for each person. Where your weakness is, that's where I would spend more time. Where your limitation is, I would spend more time on that in mobility sense. But I'm just going to kind of go through in like a broad overview of these exercises and kind of getting some of this stuff down. And then if you have questions on something specific, we can dive into that. So first thing I like to do is kind of foam roll through the whole area. So in particular for those who are in that arch position, we're going to roll more through the quads. We'll go ahead and use that to help us loosen up the front side of the thigh. And then we can work through one leg at a time, or you could do both legs at the same time. And we're just cruising along, see if you find anything tender. So I found a little tender spot right here. I'm going to go back and revisit that and let my body just kind of relax into that position. Once it starts to dissipate and that tenderness subsides, and go ahead and just work through that range of motion. You can see actually my low back wants to arch instead of getting my leg to go back here some. So I gotta tuck that in, brace a little bit more. Once that starts to subside for me, it'll be easier for me to hold that posture. So we'll go ahead and get that to loosen up, and we'll cruise through. You can find more than one spot along the line. I found another little spot, and I'll do the same thing and just work through that range of motion, getting the butt and hamstring to fire. And we'll think about on the back side of this, so like if this muscle is tight, then a lot of times this muscle or these muscles back here aren't working as much. So we can utilize the foam roller to help A, loosen this up, but B, also get some activation on the back side. And then we'll go ahead and cruise through the side part of the hip and rolling through. So if one side is tighter than the other, so you got a little shift going on and you're holding tension on this outer glute, then a lot of times this inner thigh is not going to be holding the same amount of tension. That adductor muscle is not holding as much tension because your abductor is holding all the tension on that side of the leg. And we want these two muscles to work really well together. So what I'll do is, once I find a tender spot, is I'm just going to try to lift the leg, squeezing that inner thigh. So we're trying to get that activation in the inner thigh, and then get that outer part of the hip to kind of relax just a little bit. So this would be good for a lot of people who sit. People who are externally rotated, what I'll do is get them to go into external rotation just to kind of open that up and stretch through that range some. And then we can dig a little bit deeper into those external rotators, try to get them to relax. And once you find a spot that is causing a little bit of like discomfort or tenderness, we'll go ahead and just wait for it to relax a little bit. That tenderness dissipates and goes away. Then we can start to work a little bit of range of motion here, trying to twist in and then externally rotate and working through that range of motion. Try to get that to ease up as best you can. And then once you're all set through there, this one I like to use a lot for slouchers, people that are tucked underneath, having like that slouch position in their chair and they're tucked back. What we'll do is we'll go ahead and roll. A lot of times I'll use something a little bit smaller, but a foam roller works well. But like a smaller massage ball is really a good go. Once I find the tender spot here, what I'm going to do is I'm just going to bring this leg up. And now we're working hip flexion at the same time. I'm trying to get the butt to relax here. And I'm going to try to use the opposite muscle group to get that leg up. And then making sure that that stays nice and straight as I work through. So a lot of times, I'll flip this way, when people who are tight in the butt and they're slouching group, when they go for this, they're going to try to pull up and they're going to start to externally rotate. We want to work a little bit more internal rotation just to keep neutral, so you're not going to be like here as you pull up. You're just going to try to keep that leg nice and even as you're working through that position. And a lot of times I'll go for about 8 to 10 with ranges of motion, whether you're bending your knee when you're rolling your quads or you're pulling your knee up as you're going through hip flexion, working through the glutes. And once I get all that stuff rolled out, what I'm going to do is I'm going to go ahead and just stretch through those areas. So like if you're more tight in your hip flexors, you might spend a little bit more time here in a nice hip flexor stretch, tucking the toe out back, pulling the hips underneath, and then we'll bring the same side arm up. And I'm going to try to keep my pelvis nice and level here. So you can use your waistband as a good guide, or you can put your hand on your hip, feel the bone in the back and feel the bone in the front, and this should be nice and level across with your hand when you feel those 2 points. And then from there, hold on to that as you lift your arm overhead. Once you foam roll, our stretching time, holding the stretches, we can kind of drop that down because we already got like a pre-stretch going. So like 30 seconds here. 1 to 3 times is a good number. Like it's going to depend on how tight you are, how frequently you do this stuff. There are going to be things that are going to come into play. And then for stretching the lateral part of the hip, I like to cross this leg over and then bringing this leg up, similar to the position that we were on the foam roller, and then we're going to bring knee to chest. We have a nice deep stretch here in the piriformis muscle. That's a strong external rotator. Also get a little stretch from like the glute med, that's kind of the side part of the hip. And we'll get that stuff to loosen up. Again, it's going to be the same time here. This might be more for the people who slouch. Will feel this pretty good. People who are externally rotated, where they sit with their legs slightly turned out. This will be good. And then after we do that, I like to go into some internal rotation, stretching inwards. I'm going to walk this foot out, and then I'm going to take this leg, put it on top, and then just gently pull it down. I'm going to try to keep this hip down on the ground, try to keep my core engaged, and then I'll feel a stretch out here in the side part of the butt, and maybe feel this muscle in here working as it drives into internal rotation. I'm really trying to work through the core to keep everything nice and steady here. I don't want to have this kind of roll up. I want to keep that rolled down, keep this back here nice and steady, and then we'll hold on to that position. So that'll be a good one for folks who are externally rotated. And then also like to do just a good straight pull for that glute here, especially for those who are slouchers and they have like their butt kind of tucked underneath and their glutes are really engaged and tight. We're working knee to chest, trying to keep this nice and packed in at the foot. So I'm trying to engage hamstring here to pull that down, and then I'm pulling up here with my hands. And I like to think about trying to engage this muscle in the front. So if I let go, it's going to stay there. If I'm not engaging and I let go, my leg drops down. Right? So I want to be able to engage that muscle in that range of motion and make sure that I can keep my core engaged at the same time. So we're not just going through these ranges of motion without any like neuromuscular control or mental like drive to these areas. We want to make sure that we're really locking in. And then once we go through some of the mobility drills, we're going to start turning things on for real and really getting good engagement here. So the first one I always like to do is like a muscle synergy drill. We can use our hands, or we could use a dowel for this one. Either one is fine. I'm going to use a broomstick, but you can use just your hands. I'll show you both. So for this one, we're going to put one leg over top of the broomstick, and then one leg is going to be driving up. And what I'm going to do here is bracing the core. I'm going to try to bring this leg into the stick, and then I'm going to try to drive this leg down, almost like I'm trying to break the stick. And I'm trying to activate opposites here. So this is really good for getting some muscle balance going, getting those hips to engage well together, especially like when we're walking. And really good stretch. Awesome. So you get that in the butt, and you get that up into your back there, Paul, or a little bit of both. So if you get that more in your butt, I would think that's more butt. Sometimes when you're doing both at the same time, we can get like low back stretch, which is a good stretch too. The reason why I like to go opposites and drive one leg down and pull this leg up is because when we're walking and we're climbing stairs, we're doing anything that's like movement oriented, these two are going to be opposite of each other. Like this leg's going to be lifting up while this leg drives down. And cool. Yeah, so that's a good thing. Definitely a great stretch for that. But when we're working through that, I like to split the hips up some because it's going to help us open up some of that tissue in between, and it helps us kind of work through just gait, normal walking function. And same thing with this muscle synergy exercise. When we're going through here, and I'm going to do this one now with my hands. So this one, I'm going to be pushing up into this, and I'm going to take my hand, put this behind the leg, and then I'm going to try to drive this leg to the ground now and lift this leg up into this hand. And then all we're doing is really just contracting that muscle with our mind, pushing into our limbs, pushing our hands or our legs into our hands. And I can create a lot of tension here. I'm working my belly, working my core, and I'm working through my legs as well. And this really helps me engage those opposites. So like I was talking about, when we're walking, it's really important. Like as I step here, I'm going to be engaging my butt here, and then I'm going to be engaging this hip flexor. And then if I'm running, it's the same thing. Hip flexor and butt are going to be working at the same time. After I go through those two, yeah, give that a shot, Paul. See what you think. After you go through those two exercises, I like to go through a little bit of external rotation, or think about doing some abduction at the same time with the legs together. I prefer a heavier band than this. I have a light band on right now, but what I would do is set it to where it's like a pretty heavy band, and I'm going to try to pull the legs apart here. I'm squeezing in the side part of the glutes, squeezing the side part of the hips, and really just holding that tension again, similar to what we were just doing as we were pushing and pulling. Now we're just pulling apart. And going for about 2 sets of 10 seconds. Really good to go for. Maybe 3 sets of 10 seconds as you build up your endurance. And then I'm going to do my adductors, my inner thigh muscles. I'm going to squeeze in. I have a foam roller here. You could certainly use other devices. Like you could use maybe like a 8-inch like ball. You could use like a kickball type ball or a soccer ball, or you could use pillows, whatever you have available. And then what we're going to do is we're going to squeeze in with our inner thighs, still tucking through the pelvic floor, bracing through our abs, and just again creating as much tension as you can here in the midline. And now we're really getting everything engaged at this point. So we have inner thighs going. A lot of times for me, I'm going to do bridges afterwards. For me in particular, I like to do it with the squeeze still, just to keep that, for me, my left inner thigh sometimes isn't as active. And then I'm going to lift and squeeze and try to get this bridge going, get a little pause, lower back down while holding that tension towards the midline. And then I'll go for about 15 here. After I've already done all those other hip drills to get that sensation. So everything's going to be working together there. And then what we'll go through after that, a lot of times for most people are externally rotated. A lot of it has to do with like their sitting posture. And they'll sit like this. So we want to go ahead and bring the legs in, and then we're going to go through some hip internal rotation. We're sitting nice and tall, kind of getting our sit bones driven down into the chair and tucking up from the pelvic floor. So we're sitting nice and tall. I usually will use my fist. You could definitely use a foam roller if you're more comfortable with that. And what you can do is squeeze in, try to get those inner thighs engaged together. And then we're just going to rotate the hip inwards. So we're going into that internal rotation here. Squeeze in through this front outer portion of the hip and the inner thigh at the same time. So we're really working that together. And that's going to help us get this muscle out here firing. And then once that's firing and we're sitting more upright, we tend to sit less like this, and we can be a little bit more engaged and more upright. It takes some mindfulness, definitely takes some practice of like thought process and like how am I holding myself. These things do play a big role, but if we're going through these exercises, we're turning those muscles on, we're teaching them what we want them to do. A lot of times they'll respond, especially if you start thinking about this throughout your regular life. And then we have, one of the drill I like to do is going through like a controlled articulation and rotation of the hip. And what we'll do with that is we can use weight, we could just go with body weight, and this is going to be where circumduction comes in. That's the like multiple different movements happening at once, so you can go through different ranges of motion simultaneously. And this is a great mobility drill, but it also helps teach stability at the same time. So once the hips are loosened up and they're engaged, what I like to do is go through that hip car and work through the range of motion. So I'm going to go through hip flexion, I'm going to externally rotate, internally rotate, extend out. So now I'm in abduction, and then I'm going to go ahead through adduction and slowly control that as I lower down. And then I'm going to work through this range of motion. Hip flexion, I'm going into my external rotation, internal rotation, I'm going to drive out from internal rotation, I'm in abduction, and then I'm going to go into adduction, pulling that leg in. I'm going to really think about keeping tucked through the core, working through the abs so I can stabilize the pelvis and allow my leg to go through that range of motion. And it may seem like it looks like a simple exercise, but if you go through 10, 12 of these on one side, you're going to start feeling this burning pretty good out here. You're going to feel really good tension happening through your hip internal rotator. And you can throw, a 2-pound ankle weight on there. You'll start really feeling that. Maybe 5 pounds if you're feeling real froggy and you want to dive at it. It's a great exercise to help work on that rotation. You have to control that throughout the duration of the movement. And it teaches that range of motion as well as stability. And then, let's see, did I skip anything? Awesome. So after we go through our rotations, I like to go into just some flexion if you're struggling with hip flexion, if you're one of those that has your pelvis tucked underneath. So what we'll do with that is set up a band towards maybe the bottom of the door, or anchored on something stable towards the bottom. So I got a band anchor here at the bottom of my rack. And what we'll do, set up a ankle cuff, put the metal pieces sticking out the back side of the leg, and then you're going to face away from that, and then I'm going to work on pulling that leg up, trying to keep that nice and neutral. So especially if you are one to externally rotate, you want to make sure that that leg is coming straight up. You don't want that to pin and have that like rotate on you. You have to work on keeping that nice and straight. Foot is right under the knee in line with the hip. And then just working through about 15 here is a great one to start to integrate that motion in. After we've gone through the flexibility, the stretching out, getting the glute to allow us that freedom, and then getting that internal rotator to work so we're not bowing as we lift up. And then we'll go ahead and do our lift and trying to work that action with the band resistance there. So we'll go for those to help us integrate that in for folks who have an issue with their butt tucked underneath. And then I like to use a bird dog for those who have a hard time extending without using their low back. So bird dog is going to be on all fours. And what we're going to do is kind of pack in to our tabletop positions. We're nice and engaged through the core. And then what I'm going to do is I'm going to drive opposites out. And this might be an advanced exercise for somebody who goes to here and they start to arch right away. So what I might do is take a step back and then just work on extending back, keeping that nice and neutral. So we do not want to have this arch happening as we go through. We have to keep tucking up from the pelvic floor, drawing the belly button straight back, and then reaching out. So figure out where you're at with this. If it's tough for you to hit that position and you start to arch like I just did, then what you want to do is just break it down, and film yourself doing this exercise. If you see yourself arching your back really hard, then just go into this position here and reach back, touch. And then work on getting a little bit more elevation with the leg. And then just starting to build that up to where you can extend here and get all that in to the right position. But that's a great exercise for those who are tight through the hip flexors and they have a hard time going into true hip extension because they're using their low back to create that position. So it's a great drill to mix in there to help you out with that. Let's see. So we went through all these things. So one thing I wanted to touch in on too, and we'll get more into this with future weeks, is going to be just like gait and how these things work. So like if a muscle is really tight and say I'm like externally rotated and we have this natural occurring awesome response that the body does when we're walking or when we're doing something, the stretch reflex cycle. So like when we're walking and I'm trying to take a step, like as I'm going through this, I'm going to end up stretching this part of my leg as I step out, and then it's going to contract. And there's an automatic response of like that muscle stretches because of the position we put it in, and then it's going to contract as a response. And it's a safety mechanism that the body has automatically built in, so that when it does get the stretch, it can contract in response to that. And it really helps us out when we go through our gait cycle with either walking or with running. So as we're stepping, we get that stretch in the back of the leg, and the back of the leg contracts, pushes us forward. Same thing happens here. I'm stretching through the hip flexor, back of the leg is contracting, and then as the foot comes off, that automatically is going to contract, pulling the leg forward, and then we step. And then as that's pulling the leg forward, this has to let go. What happens when we're too tight? The body gets inhibited by the stretch reflex cycle, and it just can't go through the same actions that need to occur as we go through just regular gait. Or if you're playing a sport, and you have some muscle tension that's inhibiting the opposite, we're just going to miss out on that ability. And what happens is it just compounds the lack of ability, and it just builds it up and builds it up to a point, like at some point in time, it's going to become like an irritant. Then we'll talk more about stretch reflex cycle, and we'll talk more about how this all ties in with the core. So we've been kind of breaking things up into bits and pieces, but everything has to be tied together because everything works as one cohesive unit. So in the next couple weeks, we're going to be talking about slings and like fascial lines a little bit more. I think that'll be a really good time to start talking about how these things integrate with each other and how they work with each other in like the global spectrum, like everything as one unit instead of just breaking things up into little pieces. I think it's really helpful to look at it in the sense of little pieces and then kind of take that understanding and that knowledge to the next piece of being all one unit.